don't wish what happened to the CEO of United Healthcare on anyone, but if I'm honest, as a healthcare worker of 12 years, I'm not surprised it happened.
So you're telling me that this man, the owner of United Healthcare, was taken out by this young man, 26-year-old called Luigi Mangione, and the entire country of America is having no sympathy for the dead man, but they are rooting for the young man who took out the CEO?
You want to know why nobody cared that the CEO of United Healthcare died? I have two stories for you. One, first story, I worked at a dental office. We had a patient that had a crown done. The insurance company paid it. Months later, the insurance sent a note to the office asking for their money back. They re-reviewed the claim and decided that there wasn't enough cracks and decay, so they would not pay for the crown. They asked for their money back. Two, I worked in the urology department and the pre-authorization department. I had to call the insurance company to get a bladder surgery approved. Patient had cancer. The agent is going through a list of questions that I have to answer. She got to a particular question and sighed. She said, the question was, do you think the patient is going to live more than 5 years? Here I am, a $12 an hour employee, talking to probably a $13 employee, deciding whether or not a patient should get a particular procedure based on whether or not they're going to live more than 5 years. That's why. That's why nobody cares.
The hoops, loops, and ladders patients need to go through just to try to get an exam approved by insurance is disgusting. It really is. I know United Healthcare has been doing some shady things with their reimbursements with doctors and charging their customers more money while giving them less access, but this brings up a conversation that we should be having about all health insurances, okay? There have been many a time where we've had to turn patients away the day of their test because their health insurance said no. You know, in healthcare, there's this rule of benefit outweighs risk, which means if you hit your head and you come to the hospital and you're unconscious and you cannot give us any of your medical history and we have to do a test on you to see what's going on with you, we can go ahead and do the test without your consent because the benefit of that test outweighs the possible risks that can happen to you. Because baby, we're prepped for the risks. You're at a hospital. So in healthcare, we put our patients' well-being first. But when you have to deal with health insurances, baby, they work backwards, okay? They will put you through all the risks before they get you to the benefit, girl. And so that is why healthcare and health insurances clash so much, because we're patient-driven, they're money-driven. And so after working in healthcare for 12 years and hearing and seeing what these health insurances do to my patients, yeah, learning what happened to the CEO of United Healthcare really didn't surprise me. And I hope that this sparks some kind of conversation moving forward before the new CEO steps in, because if things don't change, this can happen all over again.
And people are saying, what? This is the list of all the CEOs in the United States that own insurance companies. They are next because as American people, we are tired. Healthcare insurance is extremely expensive, but just for you to decline our claims, we are paying money for you to save lives of us and our families, and you are benefiting from their demise because now you do not want to pay? Okay, that's how it's working. We support Luigi Mangione for taking you out. Let you be an example to other insurance companies that we pay this money that we can never get back. The bare minimum you can do is to pay for our medical bills.
Could you imagine paying into insurance and paying into a company that literally is designed to make sure you don't get the care you need, allegedly, and then watching your kid, your spouse, your parent be unalived because you cannot afford these astronomical amounts that are not regulated at all? That's enough to make a person snap. I hate to say this, but if you play devilish games, you're going to get devilish prizes.
Hi guys, welcome to my channel. My name is Natskunda Esther. If you're new to my channel, hi, welcome. If you like my content, please consider subscribing, like, comment, and share. Let me know what you think in the comment section about this situation. We just had a conversation about Obamacare. Why people ranting on the internet? Oh my God, we never wanted Obamacare. We want affordable care. Just for them to find out, affordable care is Obamacare. It was not given to them by Trump. It is actually Obama that started it. So we have been talking healthcare here, right? Then I find out that right now in America, this YouTube channel of this young man who is in custody right now for taking out the CEO of a healthcare insuring company is posting teasers on YouTube telling people his motives, why he did it, what's coming, what's next. It is so bizarre to me right now. I have never seen white and black Americans come together for a reason until this entire Luigi Mangione situation. Before the taken outer, the pew-pewer was caught, everybody was just talking about the CEO being taken out. But then the reasons have come out why the pew-pewer pew-pewed the CEO. So it has actually made me understand how insurance works. Because earlier this year, I wanted to take insurance. In Uganda, in my country, it's not a must for someone to have insurance. But it kind of looks like in American lifestyle of living, it's nearly impossible for someone, a normal citizen in America, to not have health care insurance. And insurance is supposed to be there to protect you in case you don't have money, right? Because this is something you pay for every month, right? Well, just like any other person, Luigi Mangione's family were under the UnitedHealthcare. And he just lost a loved one because UnitedHealthcare refused their claim. After paying money for all these years, their entire family is insured under UnitedHealthcare. A family member gets the problem and he's like, not on my mom's life, not on my parents' lives. They have been giving you money for years. Now it's time for you to pay a single fraction of what they have been paying for, and you are refusing the claim? Or not on my watch. He does the unthinkable, just to open up a rabbit hole of American people having stories on how much 32% of people insured under the UnitedHealthcare insurance company are rejected when they claim.
We pay $1,000 a month for a healthcare policy that has a $10,000 deductible. My empathy only extends so far. We've been trying to tell you that for-profit healthcare kills poor people until now. Nobody deserves to get on their way to work. Nobody deserves to get their healthcare claims denied either. Be mindful of how this story is covered. Be mindful of how people are expecting us to have empathy for a man that's worth $40 million, is the head of a company that made $6 billion in profit. And the reason they made $6 billion in profit is because they deny 30% of their healthcare claims. They want us to have more empathy for this man than they want us to have for the people that are because of his company and because of how his company operates. And you know what? We're privileged. We're lucky. We're healthy. I couldn't even imagine having a family, having kids, having a chronic health condition. We've been trying to tell y'all. The way insurance companies treat patients and the way insurance companies treat doctors is criminal. They are liable for way more deaths than a single gunman. Never, ever, ever forget that.
It's giving health insurance companies, you pay them year to year to year to year. They take the money straight out of your paycheck before you even pay tithe. But when something happens to you, they have the right to let you die. Like, they can literally let you pass out. When you paid your money, you insured your life with them. They have failed to do their job. So which means you are paying insurance, making them rich. When they reach a time where they gotta do something for you for the money that you have been paying them, they can decide to do so or not. American TikTok has schooled me. I am schooled from scratch.
$10 million was his bonus, not his salary. His salary was like $23 million. And his company has the highest rate of declined claims out of any health insurance company in this country. 32%, don't you know? With some families' deductibles being as high as 10, 12, 15 grand with children that have cancer. Not only is UnitedHealthcare one of the largest insurance companies in America, it's one of the largest companies in the world. The CEO in question would use faulty AI in order to auto-deny claims. The company has been accused of purposely adding unnecessary diagnoses to patients' records in order to justify overbilling, on top of purposely restricting provider networks in order to potentially restrict access to care, and thus less of an overall bill for them. They were also a party to and a target of one of the most major data breaches that have ever happened in healthcare history, compromising millions of patients' sensitive medical information.
You know what I think is the craziest part of the news coverage around this manhunt is the fact that they keep saying, we don't have a motive. We don't know what his motive was. We don't know the motive yet. What? What do you mean you don't know the motive? I mean, I'm no investigator, but I think we could speculate that it has something to do with the millions of people that they have looked over. But this is just me speculating, so...
Deny, defend, depose. Dr. Leslie, forensic psychologist, digging into what was written on the shell casings that took the life of the CEO of UnitedHealthcare just yesterday. Were you denied healthcare? Do you need to defend someone like yourself or someone else? And why depose? Depose can be used in the English language to remove someone immediately from their high-ranking position. There are a million theories going around about this man, but I'm starting to think that he was in the military of some sort and he was upset and something has happened related to healthcare.
So I took CEO out of my LinkedIn bio. No reason in particular. I didn't want nobody to get the wrong idea. You know what I'm saying? I heard that CEOs have 30 minutes, child. So mind you, the only employee I have is myself. But I didn't want no confusion, because after what happened the other day outside the hotel to UnitedHealthcare CEO, that's crazy. But what's even crazier is right after that, I read a headline saying that another insurance company is gonna stop giving anesthesia for the full time. So they're only gonna cover it up to a certain time. And I'm confused because I want to know, if you're the CEO of that company, you ain't see the news? No funny shit. You ain't see what happened to your colleague? You ain't see how within 30 minutes they had started the meeting on time, stepped over his body, had his emails forwarded, and had his job posted on LinkedIn within the hour? I don't know. Y'all might want to rethink that anesthesia thing.
Oh, baby, as a previous UnitedHealthcare employee who worked under Brian Thompson in the Medicare department, I have a couple things to say because, whoo, have I seen some things. Now, number one, this video isn't completely alleged in my own opinion, and it is my experience from working there for quite a few years. Number one, everyone keeps talking about how this was like a trained man, and I just don't think that. If you watch the video closely, you can see where the dude fumbles, right? In a trained... You don't see them. You just see the effects or the damage from their actions, right? This looks like someone who, it was a loved one whose care was denied, and they just happened to find someone either desperate enough or brazen enough to take a payment to go do this in broad daylight, right? That is number one. Number two, I cannot tell you the antics and the ways in which, or the lengths they will go to deny things, especially for Medicare patients, which again, that's what I worked in. they would deny almost everything immediately, right? With very little to valid reason, okay? And a lot of it was they banked on the fact that a lot of these people were elderly, and if they made the process difficult enough, they would just say, screw it, and either pay for it or not get the service, right? On top of that, there would be like tier exceptions because some of the medications would be so expensive, and you know the doctor's always going to call in the brand name because we got to get those kickbacks, right? Especially off Medicare patients, and don't even get me started on Medicaid patients. And so then these people wouldn't be able to afford their medications. They would deny the stuff. They would deny claims, like all kinds of things, right? Enough to make someone snap for sure, okay? Because it's just antics and games to them, allegedly. The next thing is the donut hole. I'll give you an example of how little empathy they actually have for anything but the bottom dollar. So there's this thing called the donut hole, right, with Medicare, and basically it's where they stop paying for the prescriptions until you've paid a certain amount. Insulin is the one that used to be so heartbreaking because we would get these phone calls and they would be like, I am going to be unalived without this medication. I'm on a fixed income. I cannot afford $1,400, $1,500, $1,600 for a 1 month prescription. And do you know what we were supposed to tell them? Contact the manufacturer for a coupon or see if you can go on GoodRx. And that was the only advice or anything we were supposed to give them. I had a guy call me with Lou Gehrig's, and he was like, I cannot afford this brand name. And the doctor was adamant he had to have the brand name because why? Again, kickbacks. This medication was outlandishly expensive. They denied the tier exception request to make it cheaper. They denied all things for no reason, quite frankly. Didn't bother to say there was a generic, nothing. Just, you got to pay for it, okay? This guy luckily kept doing his research, and I was like, you know what? There's got to be something we can do. This dude was crying. It was an awful situation. I literally Googled an alternative, if there was a generic alternative, and lo and behold, do you know what there was? And do you know how much money it was? It was like $20-$30 for a month's supply. This guy was just so grateful. He sent me flowers, thanked me, made a big deal out of it, and he was trying to help me get kudos. What ended up happening is I ended up getting in trouble because I went behind them after they had already denied the prior authorization and tier exception request. I went behind them and helped this gentleman get his medication that was covered, and they had to finish paying for it.
Y'all keep talking about this CEO, and why are y'all not mentioning he did this in 4 minutes? 4 minutes. It takes 4 minutes to boil an egg. It takes 4 minutes to make some ramen. It takes 4 minutes to listen to Born This Way by Lady Gaga. And y'all saying it took him 4 minutes to pew that man, rent a city bike, drive it down to Central Park, get rid of all his clothes, and disappear in broad daylight. It took that man 4 minutes. And now y'all want our help. For $10K? I will give y'all another $10K to not find him. I'm scared. I don't want to find that man. I wish I didn't even know what he looked like. I feel guilty because I seen the picture of him. That scares me. I don't know how I'm gonna sleep tonight. But even if they did find him, I still would not sleep right because I know that there are now people capable of this.
Let's take a look at some of the other horrible things that have happened to people. Last year, 2 elderly people insured by United, they were denied life-saving coverage by United because the company used an AI model with a 90% error rate to determine the claim. A college student insured by United racked up $2 million in medical debt to treat a severe medical issue. He said the company intentionally ignored a report that said this treatment was medically necessary. A man's $140,000 heart surgery wasn't covered by United at all because they said that he used a type of injection that wasn't medically necessary. He didn't even use it. Patients recovering from strokes and falls, often elderly, were denied nursing care from United and were often only covered for half the time needed to recover. Now, United's claim denial rate is one of the highest in the industry at 32%. An insurance company's biggest expense is what it pays out in claims. If it denies more claims, it pays out less, and then it gets to keep more profits. Now keep that in mind when I tell you that United Healthcare CEO Brian Thompson is one of the highest paid CEOs in the industry, taking home about $10 million last year. So it is sad that this poor man cannot spend his $10 million.
I could see why a lot of the health insurance CEOs were very, very nervous about their photos being up. Because look, in all honesty, he was like lower tier. He did a lot of denials though, and he used AI. So I'm wondering if all the amount of denials, since they had like 90% of the denials is one of the key factors. But yeah, this is crazy. I think it's kind of crazy how much these people make, how much money these billionaires make. I mean, I guess good for them. But then when you live this type of lifestyle, do you lose compassion? Do you lose empathy? You know, only if it affects you, right? I guarantee these people, if anything happened to their family, they would have the means to pay for it. Obviously, a lot of us are struggling. So every time we go to the hospitals, you know, a hospital stay, a day in the hospital is like, if you got to stay overnight, that's like almost like $10,000, maybe $5,000. And then the insurance company isn't paying all of it or isn't even approving it. Do you know some insurance companies, you go to the emergency room and that emergency room might be in your pocket network, but let's say the person who's doing the x-ray, they aren't, or the physician, the ER physician who visited you in the emergency room, who evaluated you, they're not in that company's profile. But like when you're in an emergency, you're supposed to say, hey, do I get covered by? It's just a scam. These healthcare insurance companies are all scammers, taking from people who absolutely need help. Most people don't want to go to the hospital unless something is wrong with them. And I was born with a pre-diagnosed medical condition, whatever they want to call it. I was born with a heart defect. So I probably wouldn't even have insurance if it wasn't for my employer. When I was a kid and I had to have surgery, my father's employer fired him before I had to have surgery. Luckily, the Ronald McDonald Fund and some state charities paid for it.
You know why I don't care that the CEO of UnitedHealthcare was also a husband and father? My mom died from complications due to diabetes. Diabetes requires a lot of supply, not just things like pumps, insulin, needles, test strips. It's things like batteries, alcohol wipes, Band-Aids, tape, gauze. 6 months before my mom died, her health insurance let her know that all of the things that she had been prescribed and insured for the last 10, 15 years of her life were no longer going to be covered. The insulin her life depended on, the pumps her life depended on, and the batteries that go in those pumps. The morning after my mom died, and I'm talking not even 24 hours after, 7 a.m. the morning after my mom died, a box full of all of my mom's supplies for the next 4-6 months showed up on my front step. And inside the box, with all of her supplies, there was a letter that said, due to the change in your current situation, we have now fully insured and covered your supplies. The current change in situation was listed as death. Patient expiration. So yeah, it makes sense that all of the health insurance companies in the United States have now taken their CEOs off their websites, because it's not a matter of if this happens next, it's when.
Okay, so by now we've clearly all already heard that they've caught the alleged suspect in the United Healthcare CEO murder. And if you've been following along, they're claiming it's this 26-year-old kid named Luigi Mangione, and he was just found at a McDonald's in Pennsylvania just with like all the evidence on him and everything just very much so pointing to him. But I've also promised you all that I'm in my chaotic villain era officially, so I'm going to entertain the delusions because you know what? The math isn't mathing on this one for me.
Luigi Mangione? I don't think he did it. And even if he did do it, you know what I mean?
He's good looking. He took out a corrupt CEO because of his grandparents. Didn't bother anybody else and apologized when he got caught. And he likes to read? Where are the book tag girlies at?
Luigi Mangione cannot be pardoned by Joe Biden or any sitting president unless he is charged federally. Right now, I'm only hearing of state criminal charges, of which the president cannot pardon, but if he is charged federally, those can be pardoned.
He turned himself in. You think a valedictorian, Ivy League graduate goes through all of the precision of all of that and then just happens to be walking around days later with all of the incriminating evidence on him?
I'm driving to New Mexico for work, and I have never wanted to just pull over on the side of I-5 more in my entire effing life than right now. I cannot believe that I'm going to be stuck in the car and not able to just scroll through freaking updates this whole time. Luigi! I love
The police think we slow. Luigi gotta be a fall guy. I haven't met anybody named Luigi since I played Mario. How many of y'all know a Luigi? That's what I would like to know. Cause I don't know any. All of a sudden he in McDonald's with everything he needs to be convicted with. Come on now.
Americans have schooled me from scratch. The Nara Smith of teaching someone from scratch when it comes to insurance. American TikTok has told me I never understood it was this deep. I was about to put myself into insurance, of which it's marketed to be a good thing. And if you think about it, it's a good thing. But just for your money to be paid for years and years, and literally insurance companies let you I plead the fifth. Please free Luigi Mangione.